Welcome to this short video on ARFID. There's lots to know, so let's get started. ARFID is a recognised eating disorder and stands for Avoidant Restrictive Food Intake Disorder. Previously, you may have heard ARFID referred to as Selective Eating Disorder or SED. In simple terms, ARFID is an eating disorder where the person has a restricted diet, predominantly due to a fear of eating outside their safe group of foods. The video will give you a deeper understanding into what ARFID behaviour looks like, what causes ARFID, and importantly, how to help someone overcome the challenge of having ARFID. Most people have heard of anorexia, bulimia, and binge eating disorder, but ARFID is not as well known. In 2013, ARFID was listed as a recognised eating disorder in the Diagnostic and Statistical Manual of Mental Disorders. This manual is the primary diagnostic tool used to assist doctors and clinicians in their diagnosis of people with mental health disorders. ARFID is not a lifestyle choice. It is a recognised mental health issue that will require professional help and guidance on the recovery path. Okay, so what does ARFID behaviour look like? Someone with ARFID typically has a restricted number of foods that they will eat. When they do attempt to try something outside of their safe group of foods, they might feel anxious or nervous, they might have a tantrum or start to cry, they might even experience a choking sensation or vomit. It's as if their mind and body is afraid to try the new food. And forcing someone with ARFID to try a new food only makes matters worse. The ARFID person does not respond to pressure, bribing, shaming, or logical explanation because the ARFID behaviour is not conscious, it's subconscious. And as the person with ARFID gets older, this fear of food sometimes turns to disinterest. Food has given them so much stress over the years that their mind and body just doesn't try anymore. Someone with ARFID can also have lots of food rules. Things like foods can't touch on the plate, food has to come from a particular shop or be a certain brand, there must be no spots or blemishes on the food, and many more. These rules are just the mind's way to manage the internal stress felt around food. The ARFID person can also have a heightened sensitivity to the taste, smell, and texture of food. Fear and anxiety put the ARFID person on high alert for their non-safe foods, and so food and fear become overlapped in an unhealthy relationship. The ARFID person's diet is typically made up of bland, beige types of foods. Sometimes called the toddler diet, it consists of refined carbohydrates, foods high in sugar, and processed meats. There is generally minimal fresh fruit and vegetables and limited protein choices. It's not difficult to see that this type of diet is nutritionally challenging. However, the ARFID person is not always underweight. They can also be normal weight or overweight, depending on how the limited diet impacts their body. However, many children with ARFID do experience weight loss and develop nutritional deficiencies. Some may even require feeding tubes and dietary supplements. ARFID children at this end of the spectrum need close monitoring and may require medical intervention to stabilise them. Unlike anorexia, people with ARFID are not negatively focused on body image. Body shape and weight do not drive their behaviour. The person with ARFID is not restricting their diet deliberately. In fact, the ARFID person may want to eat a food, but they just can't. It's as if there is a really strong internal part of them that makes them afraid to try new foods. And generally, that's what ARFID is. It's a fear of new foods. And the word we use to describe an extreme fear is phobia. In simple terms, due to an event or phase in the ARFID person's past, pain has been associated with certain foods and the person's system refuses to venture past its safe foods. The person with a phobia of spiders is not doing it deliberately. We have sympathy for them and understand that they are not consciously in control of their fearful behaviour when a spider is present. In the same way, the ARFID person has a fear of new foods, and they are also not consciously in control of their fearful and avoiding behaviour around new foods. The spider phobia person might only see a spider once every few weeks, but the ARFID person is confronted with food 3, 4 or 5 times a day. Imagine having your biggest fear presented to you 5 times a day. It's exhausting and not fun. And just to complicate things for parents, most kids go through a fussy eating phase. But ARFID is not fussy eating. Fussy eaters are often just picky, stubborn, or play up on the special or preferential attention they get. They may genuinely dislike a food and not want to eat it at that particular time, but they can or could eat the food if they wanted to. Fussy eaters also tend to grow out of this phase. The ARFID person, however, has a true phobia around food. The ARFID person may be hungry, may be desperate to eat food, but their brain stops them from eating the food or swallowing it. You can bribe a fussy eater to eat a food, but if you try to bribe an ARFID person to eat a non-safe food, it just won't happen. They would rather starve than try to eat the non-safe food. ARFID typically shows up between the ages of 0 and 4. Some children are born with the behaviour, but the vast majority develop the ARFID behaviour after birth, in the formative years. When we're young, our instincts are on high alert for trouble, and food gets most of the blame. Here is a list of some of the triggers that can kickstart the ARFID behaviour in small children. Things like colic and reflux, problems with transitioning from liquids to solids, traumas like choking and vomiting associated with food, allergies, bouts of gastro, tonsillitis, negative reactions to medication and vaccinations, and many more. An inner instinctive part of the child makes a connection, rightly or wrongly, that food is causing the body distress. Nobody likes stress, and so the behaviour of food avoidance begins. Coupled with this, research has shown that the ARFID child is typically more sensitive and has a tendency to anxiety and worry. The anxiety, fear and stress that is displayed around new food can also be present in other areas of the ARFID person's life, like trying an activity for the first time, going somewhere new, and doing things outside of the person's comfort zone. ARFID can also be experienced in conjunction with other issues like sensory processing disorder, autism spectrum disorder, and other disorders. The oversensitivity to new foods in these disorders is heightened by anxiety and stress. Reducing anxiety and fear around new foods is the key to managing ARFID behaviour. ARFID affects children, adolescents, and adults. There is the obvious problem of a restricted diet, but ARFID causes lots of other difficulties. Birthday celebrations, school camps, sleepovers, family dinners, vacations, all revolve around food. And what should be pleasant experiences are now tense and stressful for both the ARFID person and their family. The ARFID person also has to deal with the constant pressure of feeling embarrassed and different. Nobody enjoys standing out from their peers, friends and family, particularly when it comes to behaviour around food. For adults and adolescents, there is the added complexity of relationships and work. Explaining ARFID to a new boyfriend or girlfriend can be highly stressful and embarrassing, and not everyone understands. Building relationships at work often revolves around lunches and dinners with colleagues and attending training days. Some adults have missed promotion opportunities due to their ARFID behaviour holding them back. And overseas and interstate travel is nearly an impossible hurdle for the ARFID person. Left untreated, ARFID rarely corrects itself without professional intervention. But the good news is, change is possible. Professional psychological help can guide the ARFID sufferer out of the prison of their ARFID behaviour. Some of the therapies that are promoted to help ARFID are CBT, FBT, food therapy, SOS therapy, dietitian advice, nutritional supplements, and many more. Most of these are long-term therapies requiring 30 or more sessions. Some of these therapies have been historically used with anorexia and bulimia. But even though ARFID is an eating disorder, it is not the same as anorexia and bulimia. Whilst some of these treatments may help some clients, treating ARFID successfully generally requires a different treatment model. Felix Economakis is a successful clinical psychologist based in London. Over 10 years ago, he pioneered a therapy protocol that helped ARFID clients overcome their heightened fear around trying new foods. The therapy is usually successful in one session, the measure of success being that the ARFID client can calmly try their non-safe food at the end of the first session. Over 3,000 clients have been treated with this protocol so far, with over a 90% success rate for adults and a 65% success rate for adolescents and children over 8 years old. The therapy involves educating the client not only about ARFID, but also about what is going on in their mind and body to cause ARFID and perpetuate the ARFID behaviour. The problem becomes reframed in the client's mind. With deeper understanding comes a reduction in fear, and the hypnosis part of the protocol helps consolidate and communicate change to the inner part of the client. Whilst ARFID does have some common behaviours, it can look different from person to person. Some ARFID people don't eat any solid foods, some have 5 safe foods, others 15. Some eat a food for a while and then drop it, only to pick it up again later. But for most, food is a constant battle that contains little enjoyment. The key determining factor for ARFID is that the person is unable to eat outside their restricted group of safe foods without triggering some emotional response or disinterest. The Specialist Hypnotherapy Clinic in Melbourne, Australia, uses the Specialised ARFID Therapy protocol to help change the lives of clients battling the restrictive eating behaviour of ARFID. This therapy is best suited for adolescents, adults and children aged 9 and above. The clinic has alternative therapy options for children 8 and under. Hopefully this video has been an informative and interesting insight into ARFID. If you would like any additional information, contact details, ARFID support group pages and websites are listed here for you. And finally, if you have ARFID or are a parent or carer for someone with ARFID, don't give up hope. Seek help. Change is possible. Thank you for listening.